Good day, I am Nicole Mojico from BSN 1D, and today I am going to perform the assessment of the female genitalia and the rectum. So, first is to gather the necessary equipments: the stool, light, speculum, gown, sterile gloves, emmesin basin with warm tap water, the surgilube, cotton tip applicators, the chlamydia culture tube, the culturettes, the test tube filled with water, the um, air spatula, and also the feminine napkins. Then, I will be proceeding to the client. So, here I will explain the procedures to the client, but before that, I should introduce myself properly to the client as her assisting nurse. And also, I will verify her identity, and we should not forget also to provide privacy to the client by closing the door or the curtains and also performing the hand hygiene. And then, I will ask the client to put on a gown. So, kapag ready na po si client for the procedure, so we will start na po. So, I will first maglagay po ng um, sterile gloves. So, assuming that this is a sterile gloves po. So, now I can proceed na po with the assessment. So, first is the external genitalia. So, first, I will inspect the mons pubis. So, I will note for the pubic hair distribution and the signs of infestation. And the next is I will inspect the labia majora and the perineum. So, I will note for any swelling, excoriations, or lesions. And then next, I will also inspect the labia minora, the vaginal opening, the clitoris, and the urethral meatus. So, I will note if there are any excoriations, lesions, swelling, and discharge. And kapag po to properly inspect po, I can use my gloved index finger and thumb na para po mai-open siya, in which makikita ko po yung certain parts na nasabi and need to inspect. And then next po, I will be palpating the Bartholin glands. So, nandito po si Bartholin glands. So, to properly palpate po, I will be my index finger po is dito po sa vaginal opening, and yung thumb ko po is nandito sa may labia majora, and I will be pinching it po gently for palpation, and dito naman po. So, gagawin ko po ito kapag there is current swelling na na-notice or meron pong history ng swelling. And then, I will note po for the discharge, for the tenderness, and swelling. And then po, I will also palpate the urethra. So, kung meron pong symptoms ng urethritis and inflammation on skin glands. So, to palpate po the urethra, so, yung index finger ko po ay lubricated, and then, i-insert ko po siya sa vaginal opening. And then, I will be milking out the urethra. So, pushing up and out gently. Okay? And then, I will observe for the drainage. And then, next po, tapos na po tayo sa external genitalia. So, we will proceed with the internal genitalia. So, in internal genitalia, I will be inspecting the size of the vaginal opening and the angle of the vagina by moistening my index finger with warm water, and i-insert ko po gently sa vagina. So, next po is to assess the vaginal musculature. So, naka-insert lang po ang aking index finger sa vagina ni client. So, I will ask the client to squeeze her vagina around my fingers. And then, after po that, using my index finger and middle fingers, is isa-separate ko po yung labia minora. And then, I will ask the client to bear down and um, inonote ko po and observe kung meron pong discharge ng urine or bulges. And then next po is I will perform the speculum examination. So, ang speculum po is gagamitin kapag po hindi na po virgin si client. So, assuming that this is a speculum po, so I will be inserting it po sa vagina. So, dapat po lubricated din po yung speculum before inserting. So, I will insert it gently. Okay. And then next po, I will inspect the cervix for the color, the position, the color, the position, the surface, the lesions, and discharge. And then next po, I will be obtaining the specimen for pap smear and kung indicated po, also yung culture to test for STD or sexually transmitted diseases. And then, after po that, I will be inspecting the vagina habang po ina-unlock ko po yung speculum. And also, i-inspect ko pa rin po siya habang niro-rotate ko po gently and nire-remove gently si speculum. Okay? And then, I will note for its consistency, tenderness, discharge, and swelling. And then, next po is, I will perform the bimanual examination. So, in bimanual examination, I will be using my index finger and the middle finger po. So, here po, I will be lubricating it. So, my non-dominant hand po, which is the right hand. So, ilalagay ko po siya sa my lower abdomen. And then, my index and middle fingers po is i-insert ko po siya gently sa vagina. Okay? So, after this po, ipupush ko po siya doon gently sa posterior abdominal wall. And then, kapag na-relax na po yung opening is, I'll try to palpate po the ovaries. So, to palpate the left ovary, isi-slide ko po yung intravaginal fingers ko sa left lateral fornix. And then, yung hand ko po is ipapalpate din po kung nasaan po yung location ng intravaginal fingers. And then, dito naman po sa right, lateral fornix for the right ovary, palpating the right ovary. And then, ipapalpate ko rin po yung location ng intravaginal fingers. Okay? And now, I will note for the size, shape, consistency, mobility, and tenderness. Or the discharge. And also, i-observe ko rin po for any secretions. And then, next po is the performing the, after bimanual examination, is the rectovaginal examination. So, in rectovaginal examination po, need na pong mag-change ng gloves sa aking sa dominant hand. So, assuming po that I have changed the gloves na po. So, I will be using po again my index and middle fingers po. Okay? So, first I will be asking the client to bear down. And then, i-insert ko po yung index finger sa vagina ni client. And then, yung middle finger naman po sa rectum. Okay? So, here po, I will be palpating the internal reproductive structures and magpipay attention po ako sa cervix, sa rectovaginal septum, sa cul-de-sac, and the posterior uterine wall. Okay? And then, tapos na po tayo sa internal genitalia. So, next naman po is the anus and perianal area. So, sa anus po and perianal area, I will be inspecting for lumps, ulcers, redness or rashes, and I will be noting po for their size, shape, location, distribution, and configuration. And also po, I will be inspecting the sacrococcygeal area for I will be inspecting the sacrococcygeal area for dimpling, for presence of hair in the pilonidal area, and also for if there are any swelling po. And then po, next to sacrococcygeal area, I will be assessing for rectal prolapse by Valsalva maneuver. So here po, I will ask the client to bear down, and then I will ask her to take a deep breath and i-push po yung breath, pero hindi po magbe-breath na totally na ilalabas yung hangin. So, I will be inspecting the anus for bulge or lesions. And after po the Valsalva maneuver, I will palpate now the anal sphincter. So, yung finger pads ko po is ipi-place ko po siya sa anal sphincter and then with slight pressure hanggang sa ma-relax po yung sphincter. And then, kapag po na-relax na yung sphincter, is gently may insert ko po yung aking index finger sa anus. So, para po ma-determine yung tone, so I will ask the client na i-tighten po yung kanyang external anal sphincter. Okay? And then, I will rotate po my index finger to palpate the anal sphincter for tenderness, nodules, or hardness. And then, after this po, I will proceed to the rectum. So, I will be, as much as possible po, I will be inserting my index finger to the rectum. Okay? And then, I will be palpating the rectal mucosa for tenderness, irregularities, nodules, or hardness. And then, I will be palpating also the peritoneal cavity for rectal shelf, for tenderness and hardness. So, para po mapalpate properly, so I will rotate my index finger clockwise. Okay, and then counterclockwise. Okay. After po palpating the rectal mucosa and the peritoneal cavity, so pwede ko na po alisin ang aking index finger. And now, I will observe the feces for blood and perform the occult blood test. So, after this po, for the analysis of data, I will be formulating the nursing diagnosis for health promotion, risk, and actual. I will also be formulating collaborative problems and make necessary referrals.